password accepted. Loading. Welcome aboard future RMTs. My name is Emma. I'm Gavin's assistant. You are about to see highly sensitive materials that will affect the entire human race. Your absolute attention is required. Your objective is to determine whether massage therapy and intraoral massage had effects on a client with temporomandibular joint dysfunction in a case study. You must apply what you learned today into your future practice. Now, meet Gavin for your debriefing on your mission. Incoming transmission. Post-Usso. Unilateral sagittal split osteotomy is one of the most common surgeries for treating mandibular prognathism, an overgrown or protracted mandible, and laterognathism, a crossbite. This surgery removes a small segment of the mandible on one side of the mandibular ramus on the sagittal plane, and then the mandible can be moved forward or set back to achieve a facial symmetry. Removal of a segment of mandible bone on each side of the mandibular ramus is known as bilateral sagittal split osteotomy. Research conducted by Wollwender, Dake, Wingert, Brandstatter, Kessler, and Lethals in 2011 showed that Usso may be a cause of TMD. As a result of Usso, an inevitable rotational movement of the condyle would automatically change its position in the glenoid fossa, its relationship to the disc and its translational movement. Hence, the functional aspects of the TMJ could be directly influenced. Incoming transmission. TMD. Temporomandibular joint dysfunction is a disorder of the mastication muscles, the temporomandibular joint and the surrounding structures. TMD is the second most common cause of oral facial pain, affecting 10 to 12% of the general population. There are two TMJs in a human being, located approximately 1 to 2 centimeters anterior to the left and right external auditory meatus. They can be readily palpated by placing the pad of third and fourth fingers just anterior to the EAMs while opening and closing the mouth. The TMJ is a synovial joint that consists of the mandibular condyle, articular surface of temporal bone, and a biconcave-shaped hypervascular articular disc that allows the mandibular condyle to position itself in the articular surface of the temporal bone. Posteriorly, the articular disc attaches to a highly vascularized and highly innervated connective tissue known as retrodiscal tissue, which is often a contributor to the pain of TMD. Anteriorly, the articular disc attaches to the superior fiber of the lateral pterygoid muscle whose primary function is to bring the mandibular condyle anteriorly out from the mandibular fossa in order to open the mouth. TMD is dominantly diagnosed in people between 15 to 45 years old, and is more common in women by a ratio of 5 to 1. Its symptoms include one or more of the following: clicking or popping sounds occurring during jaw movement, pain during jaw movement, headaches on frontal or temporal aspects of the head, spasm in the mastication muscles, a decrease in range of motion, and hearing impair. Factors contributing to TMD can be stress, genetic maldevelopment of muscles, ligaments and bones, and external trauma to the face, the neck or the mandible. Displacement of the articular disc is another factor that leads to TMD. The mandibular condyle rests on a thicker portion of the articular disc, instead of the thinner middle portion which displaced articular disc, which causes the condyle inevitably ride over the thicker portion of the disc, and creates a popping sound and pain during the initial jaw movement. The clicking sound may be caused by uncoordinated lateral pterygoid muscles contraction. The superior head of the lateral pterygoid muscle pulls the articular disc forward in a healthy TMJ. However, if the disc does not move forward first, A clicking sound is created when the condyle is pulled forward by the inferior head of the lateral pterygoid muscle and ride over the disc. Surgical approach to TMD includes disc repositioning via arthroscopy, discectomy, and total joint replacement. However, osteoarthritis development is a common complication of discectomy. Non-surgical approach includes dental splints, physical therapy and medications such as non-steroidal anti-inflammatory drugs and muscle relaxants. Multiple research has shown physical therapy has beneficial effects for treating TMD. However, it lacks a large-scale systemic review to further confirm the efficacy. case study. Analyzing. Detected a number of errors. Pre-treatment assessments were not conducted in each treatment except the initial one, because the case study was designed to monitor the client's progress throughout the entire treatment series. This lacks the capability to monitor the client's changes before and after each individual treatment. Future studies should implement pre-treatment assessments. Due to miscommunication between the therapist and the client, the daily journal that was used to record patients' progress was discontinued on April 24, 13 days before the last treatment. Using a tape measure as the measuring tool for active pain-free and maximum mouth opening was not ideal, due to the softness of the tape. Inaccurate data could have resulted when the tape was bent. In addition to this, the measurement points were the upper and lower of mammalian borders, which were soft tissue that could be altered by muscle contractions. Proper tools to measure TMJ range of motion such as caliper or terabyte system is recommended for similar future research. Recommendations for future studies. Due to the lack of research regarding the correlation between Usso and TMD, further exploration in this area should be conducted. It would be intriguing to see research utilizing massage therapy and intraoral massage in preventing post-maxillofacial, post-oral facial surgery complications and TMD. This case study carried out positive results to the client. However, due to a number of errors occurred during the process, further research in this aspect is needed in order to prove the effectiveness of utilizing massage therapy and intraoral massage to post-Usso TMD. Remember, the future is in your hands. Now, go save the world. Transmission terminated.